On October 15th, it is expected that Social Security Administration will announce for the first time in 35 years that seniors will not receive a COLA. Based on the formula that by law they are obliged to use, they came to the conclusion that there is no inflation this year for seniors, and in fact, their understanding is that prices for seniors have declined. In my view, that is a wrong formulation, and I believe that it simply does not accurately reflect the purchasing habits of seniors. Seniors right now, I know this will become a great shock, are not rushing out to discount stores to buy laptop computers or iPods. What seniors now are purchasing, what they need, is health care, prescription drugs. And the evidence is overwhelming that seniors spend a disproportionate percentage of their limited incomes on health care and prescription drug needs. And those costs, sadly, are not declining. They are, in fact, going up.
As Senator Sanders noted earlier, a much more accurate measurement of the poverty level for seniors would show that it's twice what we measure it at. We don't have a good measure of what the inflation rate is for seniors, but we do know that pharmaceuticals continue to escalate, medical care costs continue to escalate, their rents or mortgages haven't gone down, their utilities have likely gone up. Nothing else that they have to consume has gone down in price over the last year. So this modest $250 one-time payment to seniors would be basically equivalent to a 2% cost of living adjustment. It would help them meet some of those bare necessity costs.
And I'm here today to deliver 120,000 petitions saying, hey, guess what? We need a COLA. Guess what? We've got some problems. We are the seniors of the United States. We are the seniors that built this country to be what the country it is. And I am so delighted that these gentlemen are right behind that. Let me give you the facts. 43% increase in Part A since 2000. Part B, 50% increase since 2000. Part D, now listen to this, Part D, 130% increase. Those are prescription drugs.
In Rhode Island, our seniors have a bigger proportion of their income come from Social Security than almost any other state, and we've seen with real impact what the other speakers have described, which is seniors seeing electric utility rates go up, seniors seeing pharmaceutical costs go up, seniors seeing all the real costs of their living go up, and with no real help in sight.
The least that we should do in the midst of a terrible recession for older citizens and for families all across the country is to make sure that we can provide some measure of relief that this legislation provides. That's why we support it, no matter when it would come up, but especially in the midst of this economic darkness that so many families, so many older citizens have had to endure.
A failure to provide a Social Security COLA in 2010 for seniors would be a very critical mistake and having a very negative impact on them. And also, given the economic circumstances our country has faced over the course of this past year, actually over the course of the past 2 years. This economic downturn has pushed a decline in the standard of living of many seniors. Many have seen their home values drop, their pension funds severely declined, and their savings in many instances undermined and disappearing.
My name is Esther Lynette, and I'm a resident of Montgomery County, Maryland. I'm 91 years old. And blessed to still be living independently.
Yay!
My only source of income is Social Security, and I want to say that without Social Security, I don't know where I'd be today. I really don't. Getting a COLA next year doesn't mean I'm going to be able to live extravagantly, but it means that I can keep up with my financial responsibilities and pay for the basics, especially the Medicare. medical care that helps me stay independent. My thanks to the members of Congress who are working to pass a COLA for seniors. Thank you.